Here are 3 risks you should know about if you're considering a hair transplant. So the first risk is swelling, and the reason that this occurs is because during the surgery we inject a fluid called tumescence underneath the surface of the skin to lift away the skin from the underlying structures. Unfortunately, this does often cause some post-op swelling. The second risk is infection, and when the procedure is done in a clean and appropriate environment, the risk of this is relatively low. However, it can still occur. Some surgeons may prescribe prophylactic antibiotics for you to take in the few days after your hair transplant to lower the risk of getting an infection. Risk number 3 is an adverse reaction to the medications used during a hair transplant. So during a transplant, we normally use medications like local anesthetic or adrenaline, and in some cases, patients can have an adverse reaction or an allergic reaction to these medications. So it's important that we check your medical history and your allergies very carefully. And again, this highlights that having a hair transplant is a surgical procedure and it's not something to undertake lightly.